Hello, my name is Holly Barker, and today I will be discussing antisocial personality disorder, or APD for short. Pictured below are three famous killers who were diagnosed with antisocial personality disorder: Jeffrey Dahmer, Harold Shipman, and Ted Bundy. According to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, there are 6 criteria points for diagnosing antisocial personality disorder. Criteria point A reads, significant impairments in personality functioning manifest by impairments in self-functioning, characterized by identity, egocentrism, self-esteem derived from personal gain, power, or pleasure, or self-direction, goal setting based on personal gratification, absence of pro-social internal standards associated with failure to conform to lawful or culturally normative ethical behavior, and impairments in interpersonal functioning characterized by empathy, lack of concern for feelings, needs, or suffering of others, lack of remorse after hurting or mistreating another, or intimacy, incapacity for mutually intimate relationships, as exploitation is a primary means of relating to others, including by deceit and coercion, use of dominance or intimidation to control others. Criteria point B reads, pathological personality traits in the following domains. 1. Antagonism, characterized by manipulativeness, or frequent use of subterfuge to influence or control others, use of seduction, charm, glibness, or ingratiation to achieve one's ends, deceitfulness, or dishonesty and fraudulence, misrepresentation of self, embellishment or fabrication when relating events, callousness, lack of concern for feelings or problems of others, lack of guilt or remorse about the negative or harmful effects of one's actions on others, aggression, sadism, hostility, or persistent or frequent angry feelings, anger or irritability in response to minor slights and insults, mean, nasty, or vengeful behavior. 2. Disinhibition characterized by irresponsibility or disregard for and failure to honor financial and other obligations or commitments, lack of respect for and lack of follow-through on agreements and promises, impulsivity or acting on the spur of the moment in response to immediate stimuli, acting on a momentary basis without a plan or consideration of outcomes, difficulty establishing and following plans, risk-taking, or engagement in dangerous, risky, and potentially self-damaging activities, unnecessarily and without regard for consequences, boredom proneness and thoughtlessness initiation of activities to counter boredom, lack of concern for one's limitations, and denial of the reality of personal danger. Criteria point C reads, the impairments in personality functioning and the individual's personality trait expression are relatively stable across time and consistent across situations. Criteria point D reads, the impairments in personality functioning and the individual's personality trait expression are not better understood as normative for the individual's developmental stage or sociocultural environment. Criteria point E reads, the impairments in personality functioning and the individual's personality trait expression are not solely due to the direct physiological effects of a substance, for example, a drug or medication, or a general medical condition, for example, severe head trauma. Criteria point F reads that the individual must be at least 18 years or older. In order for a person to be diagnosed with antisocial personality disorder, they must fit the criteria points listed by the DSM-5. The major symptoms of antisocial personality disorder are listed as so. The person must be able to act witty and charming, be good at flattery and manipulating other people's emotions, break the law repeatedly, disregard the safety of self and others, have problems with substance abuse, lie, steal, and fight often, not show guilt or remorse, and often be angry or arrogant. Antisocial personality disorder is believed to be caused by genetic factors such as DNA from your mom and your dad, or environmental factors such as abuse, neglect, bullying, or a strict home environment. It is also biologically thought to be caused by abnormal chemistry in the nervous system and impairment in the parts of the brain that affect judgment, decision-making, planning, and impulsive and aggressive behavior. The parts of the brain affected by antisocial personality disorder include the prefrontal cortex, which is pictured below, and is involved in planning and organization, impulse control, adjusting behavior in response to rewards and punishments, and some forms of decision-making, which could mean that anyone who has damage to their prefrontal cortex will exhibit inhibition in their ability to make proper rational decisions, such as decisions that get them in trouble. The amygdala, which is also pictured below, diminished responses in this area of the brain is what causes the instrumental aggression that is often observed in antisocial personality disorder, and reduced gray matter, which could have an effect on executive functioning. The modulatory systems and neurotransmitters that may be related to antisocial personality disorder include the SNAP25 protein, a protein located on the presynaptic membrane that is involved in the docking of synaptic vesicles on the membrane. Mutation of this protein is theorized to have an effect on the neurotransmitters by altering them, and a genetic abnormality of the monoamine oxidase A gene. The rare mutation of this gene causes it to not properly break down monoamine neurotransmitters such as serotonin and dopamine, which are pictured below, causing an abnormally high level of these neurotransmitters, which can be used to help explain the aggressive behavior that accompanies antisocial personality disorder. As far as neurological interventions go, there are none that specifically treat antisocial personality disorder. For persons with APD who also have anxiety and depression, antidepressants may be prescribed. For the aggression that accompanies APD, mood stabilizers may be prescribed. On antidepressants, scientists are unaware how they actually work. However, they do show signs of creating new neurons in the hippocampus, in which will eventually migrate to areas that need better neuronal connections in order to function properly. A major downfall of antidepressants is that they are not immediately effective. Some side effects of antidepressants include nausea, weight gain, sleep problems, and in rare cases, arrhythmia, or irregular heart rhythms. For mood stabilizers, scientists are also unaware how they work. However, they are believed to influence certain neurotransmitters that may be involved in causing mood disturbances. Possible side effects of mood stabilizers include itching, rash, excessive thirst, frequent urination, tremor of the hands, nausea and vomiting, slurred speech, fast, slow, irregular, or pounding heartbeat, blackouts, changes in vision, seizures, hallucinations, loss of coordination, and swelling of the eyes, face, lips, tongue, throat, hands, feet, ankles, or lower legs. The alternative forms of therapy for antisocial personality disorder include psychotherapy, or therapy that helps a person change their way of thinking, including cognitive therapy and behavioral therapy, family therapy, which is more for family members and helps them understand the person with APD, and group therapy, which helps the patient relate to others with the same personalities and thoughts. Alternative forms of therapy are the most common way of treating antisocial personality disorder. However, they are not always effective, and this is because there is a low adherence rate from the patients.